Nationwide, children's hospitals are filling up with young kids battling RSV.
And in the inland Northwest, it's no different. Take a look at this new data from the CDC. We first saw the spike here representing positive cases around this time last year in Washington. This second line indicating where we're at now and where we're headed. Those young kids are the ones most at risk of becoming extremely sick. Emily Bloom spoke to one local family hit by the virus with a 7-year-old named Jackson in the hospital tonight.
Jackson is going to be spending a 4th night here at the hospital. He's on the mend and starting to improve, but doctors wanted to check on his damaged lung for one more night.
Let's just say that our entire world got turned upside down.
Mike Boyle's 7-year-old son Jackson started to feel sick last Friday.
By Sunday, the cough had started to really pick up to the point where it was just turning beet red as he was coughing.
They decided to take him in to see the doctor, and 2 hours later, he was in the ER with poor oxygen levels.
When we came in, the emergency room was packed with kids. Packed. I mean, I've never seen it that busy with children.
They spent most of the day in the ER because there were no rooms available.
So they did an X-ray and found that his left lung had partially collapsed.
Pediatricians tell us RSV is not a new virus. It usually peaks after Christmas, but they're seeing much more than they usually do, and they believe it could be due to isolation during the pandemic.
Everybody's immune system is sort of, I don't know, naive again. It hasn't seen anything for a while, and so as soon as it sees something, it latches on. And RSV is now just easier to get.
RSV starts out looking like the common cold, but things can shift quickly.
If your child is having difficulty breathing, if they're coughing so hard they're throwing up, if they're really not eating well or drinking well, both, then they really do need to be seen.
Thursday night, I was with him all night. It's the first night he slept without an oxygen mask on his face, which was great improvement.
Providence shared today that they have seen a rise in patients with RSV, especially for those under the age of 5. Now, coming up on Monday, our local leaders will be sharing a message with the community about our situation here in Spokane. Reporting live in Spokane, Emily Bloom, 4 News Now.